So what have they done? I mean, you guys are already, I'm sure, familiar with much of this, and I've got it written down. I just wanted to document for some of you in writing in one place some of the cuts that already occurred to Medi-Cal and Healthy Families prior to this July 20th deal that they just announced on Monday. So Medi-Cal, you know, and some of it hasn't even happened, right? We went to semi-annual reporting, and then the Economic Recovery Act said, you can't do that, you're not going to get any of this enhanced FMAP. All right, so we're not going to do that, we just suspended that. Benefits, we said, all right, as most adults, no more dental coverage for you. You're done as of July 1st. That just took effect. It had survived its first court challenge along with other benefits. Provider payments, they keep trying to lower payments to doctors and other providers. Lawsuits were filed. In most cases, those have been blocked by federal court orders. County administration, after many years of funding the counties that does Medi-Cal eligibility, in 08-09 and 9-10, the state again said, sorry, we got to stiff you. We can't afford to pay you for your actual cost of doing business. You're going to need to eat it. Too bad if your costs are going up to run this program at the local level. We're not going to help you out with that. Healthy Families, you know, we started to see some rollbacks in that program even before the July 20th deal. Mr. Mibb just imposed an enrollment freeze. That was big news. We're going to probably see hundreds of thousands of kids being dropped from this program. I mean, I didn't really know how it worked until I started looking at this. I assumed enrollment freeze, that's bad enough. Somebody's eligible, they're not going to get in the program. But Mr. Mibb says, well, that's not going to save us enough money. In order to deal with this shortfall, we need to start disenrolling kids. A horrible piece of jargon, if there ever was one. Essentially, they're going to have to kick kids off the program who are otherwise eligible to be in there in order to generate enough savings, because the states, at a time when there's more money, federal money on the table ever before for Healthy Families, California has to start rolling that program back because we're not willing to make the investments at this time. And the rest, I'm just, you know this stuff, or you can read it. I'm not going to spend time on the rest of that slide. I'll just go to the July 20th deal. I mean, a lot of these details are still coming out. I don't know how closely anybody in here was following the conference committee's version of the budget, which came out in June, where, you know, it sort of went like this. The governor said, let's do something really awful. And the Democratic majority said, let's do something bad, but not too bad. So, for example, the governor said, let's eliminate the Healthy Families program. And the Democrats said, no, let's not do that. Let's cut it by $70 million. Now that cut is up to $124 million in this deal. So that's sort of the way it went. A lot of cuts were already on the table out of the conference committee package, which was essentially the majority Democrats' plan. So a lot of those cuts are still in there, but as details come out, we're finding out that other changes were made in order to address the governor's concerns, the governor's last-minute concerns from late June and early July. So, for example, you know, they decided to cut more out of the Healthy Families program, and they assume that First Five California will again step in with some money to help avert at least some of the disenrollment or some of the enrollment freeze. In the Medi-Cal program, the state is going to, it looks like, give the go-ahead, at least initially, for centralized eligibility processing, right? That would be taking eligibility responsibility from the counties and giving it to a private contractor, Halliburton or Maximus or something along those lines. In other states, this has been shown to be a tremendous boondoggle, and we all know how well California does on complicated and expensive high-tech projects. We're really good at doing automation here, and we're quite efficient, aren't we? No, that was kind of a joke, and may have fallen flat, but well, our track record isn't very good in this regard. So something related to this is going to be in one of these 28 bills that's part of this package. It's not exactly clear what. A lot of these other programs that I listed and some that aren't on here are still getting cut. Whatever the conference committee decided to do, that's probably what stands, unless they decided to do something worse. I can't think of one case in which, in the deal, they said, you know, conference committee did something, let's take it back. I don't think they undid anything the conference committee did. They only made things worse because things continued to get worse even as they continued to negotiate. There's a lot of words on this slide, and I'm sorry, I'm not going to read them all. You know, one of the things I was asked to do was to talk about to what extent restoration would be likely. That's kind of another jargony term. Can we restore cuts in some way? So, I mean, if you kind of lay out the way the situation looks now, and I do sort of have a positive slide that I snuck in after this one, because this one is so dang negative. But, you know, the idea here is let's look at what we know right now. This deal, if it does pass the legislature, is filled with one-time solutions, as they're called. These aren't lasting, ongoing things. There are no tax increases. There are serious cuts, but they can't cut $26 billion to solve the problem. So they got a lot of borrowing, a lot of accounting gimmicks. You know, they're going to do the June 30th paycheck for state employees on July 1st of next year. So you push $1 billion of costs that otherwise would have been stored this year into the 2010-11 fiscal year. Just imagine things like that on a scale of about $9 billion, you know, in terms of getting up to the $25 billion they needed. So a lot of borrowing, a lot of accounting gimmicks. As the gimmicks go away, all you do is push the problem to the future. We're using billions of dollars in federal economic recovery funds right now in our Medicaid program through the enhanced FMAP. Those go away after next year. Tax increases. Believe it or not, remember that some tax increases got out of the legislature in February as part of the February budget deal. Of course, they were very regressive, and they focused not on those who could most afford to pay, but those who could least afford to pay, low and middle income families. Even then, those tax increases expire after 2 years. They're going away. And it's hard to see that they would be replaced with anything. I already mentioned the fact that the legislature and governor did big corporate tax cuts in the last 2 budget deals in September of last year and February of this year. That's going to cost us $2 to $2.5 billion every year, ongoing indefinitely into the future. Think of what you could pay for with $2 billion in the health arena. That money is gone. What about economic growth? How are we going to get out of this one? Nobody seems to know. Last time in the 90s, it was the internet boom. Then we had a recession, relatively small. Then we have a housing boom. Now we're in a huge recession, and economists are going, how do we get out of this one? You know, are we going to speed boom out of this in some other way? Nobody really thinks that's how it's going to happen. It's going to be one of these very slow, jobless recoveries, you know, where maybe we're going to see jobs starting to turn around in the next couple of years, but it's not like we're going to have a big influx of general fund revenues pouring in next year. I mean, that would, of course, things always end up, you know, somewhat differently than people forecast, but it's very unlikely that we're going to see, you know, another boom of the same magnitude that we've seen the last 2 cycles. So if we don't have a lot of general fund revenues coming in, it's hard to see where does the money come from to restore all the cuts that are being made this year and in prior years. So, you know, and the bottom line here is the supermajority vote requirement. A flawed process leads to a flawed result. You can't make policy in this way, requiring 2 parties with very different visions of where the state should go to come together. I mean, some of you may have seen the emails that are leaking out. You know, I don't know if these are leaks are done intentionally or not, but the Republicans are relatively happy with what they got. They represent about 1/3 of Californians, and they're fairly ecstatic about this budget package because there are no revenues in it, and there are a lot of other things that they wanted that's in there. And really the only reason it's in there is because of the supermajority vote requirement for budget and taxes. Wild cards and possible game changers. I just felt so bad about the way this presentation was going to end that I tried to think of some things that might work in our favor in the next few years, even if they're not, you know, lasting. You know, so federal economic recovery bill. A lot of economists, particularly on the left, are saying things are worse than the Obama administration ever anticipated. Everybody thought that the package they passed in February was too small. Now we know it was too small. Are they going to, there's some talk of trying to come back and do another one. Most people aren't very hopeful, but you never know. If there's more money, that's going to be more money to help California. If we get federal health care reform or health insurance reform or whatever we're calling it, what will that mean for California? You know, there have been news reports about concern about making more people eligible for Medicaid because is the federal government really going to pay indefinitely for all of those new folks, or eventually are they going to squeeze the states and say, all right, back to your regular FMAP. California, you're paying half the cost of all the new people we just made eligible